En mi caso, a mí la malaria me dio por 6 veces. También la malaria te afecta. No tenía ganas de comer, no tenía ganas de nada. Ni de cocinar, ni de lavar, ni de atenderle a mi pequeña.
The current situation globally with malaria is that progress has stalled. Some countries continue to make great progress towards elimination of Plasmodium falciparum, only to find Plasmodium vivax a continued challenge and a drain on their program.
Unlike falciparum malaria, P. vivax can cause liver stages that are dormant that reactivate, causing repeated episodes of malaria that can go on for months.
La cuarta vez que me agarró la malaria, ahí me dejó de con más secuelas, ¿sí? Porque ya no podía hacer normal mis actividades.
The people most affected by Vivax malaria are those that are most challenged by socioeconomical issues. They're not only affected by disease, but also the consequences of it.
Pues hay personas, el día que no trabaja, el día que no gana, porque está afectando la economía, no solo de la persona, sino de la familia.
Todo eso porque estaba internada 7 días mi hijita. Una evaluación porque salió con malaria también. Días ahí, no volví a mi casa y no tenía familiar y no tenía los recursos para regresar. Pero en eso me voy a encontrar ya mi reemplazo. Me perdí ya mi trabajo.
When we treat Vivax, we have to treat both the blood stages and the liver stages, and that combination is called radical cure.
Interventions that can be really effective against Vivax have lagged behind.
Over the last 50 years, primaquine's generally been given as a 14-day course to kill the parasites.
The majority of the patient will not complete that 14 days treatment course. So that's why we keep on having these Vivax cases.
People feel better. They think that they got cured and there's no more need of taking drugs. Or because they think they will eventually get it again and they save it for later or for a family member.
If we cannot stop that, then we are going to continue to deal with Vivax malaria going forward.
The good news is that now we have a new treatment which is available in a drug called tafenoquine. Tafenoquine is a real breakthrough because for the first time in history, we now have a single-dose treatment available for patients.
Tafenoquine really ensures that you get the same effectiveness as you have efficacy, so you know you're guaranteed that the person's going to take the treatment because you can have them take it in front of you.
We also have the possibility to use primaquine at a higher dose over 7 days. The problem with both primaquine and tafenoquine is that they have a G6PD liability.
Primaquine can cause hemolysis, destruction of blood cells, if it is given to the people who is G6PD deficient.
The way we overcome that challenge is by testing individuals for G6PD deficiency.
In clinical practice, G6PD test usually takes about 1 week.
If you want to get treatment to them, you need to be able to treat them on the spot. If you send them off telling them to go to another laboratory, they don't have the money or the time, and you're not going to catch them again. Recently, a product has been made that is point of care and gives you the results within 2 minutes, and it's fairly easy to use and quite affordable as well. Then we can prescribe tafenoquine or primaquine safely to the patient.
If we can identify people who are G6PD normal, we can give higher doses of drug, which means that we can give a shorter course.
Un tratamiento de un día nomás. Me curó porque desde esa fecha hasta hoy no tengo, gracias a Dios, malaria.
These new tools will help us identify vulnerable patients, optimize treatment, and also provide it in remote rural areas where the main burden of malaria lies.
PAVE is the Partnership for Vivax Elimination, and it's a partnership that MMV and PATH co-lead.
PAVE is a global consortium of different partners around the world looking to generate evidence about the feasibility of using G6PD tests in addition to radical cure. Within the PAVE program, there are 5 different countries that represent multiple contexts for malaria, 3 tafenoquine studies that are within Peru, Ethiopia, and Vietnam. And then we have 2 high-dose primaquine studies that are in Indonesia and Papua New Guinea.
In PNG in particular, we have 80% of those they identified to be not from new infections, but they were actually infections from the relapsing infections.
In Indonesia, every person are at risk, but the impact of Vivax malaria are greatest in infant and children under 5s.
In Vietnam, we go to the last mile of malaria elimination. We will eliminate malaria Vivax by 2030.
We wanted a really large breadth of different healthcare facilities and different levels of healthcare facilities in addition to the different countries and the different populations that they serve.
Diversity of site gives you perspective about the scope of challenges that the world might face in different contexts. And it gives the opportunity to then raise questions about how do we collaborate between countries, and how do we share protocols, and how do we tackle a disease that doesn't respect borders.
The evidence that we generate can extend to the populations and the countries that are not part of PAVE.
Ethiopia is a huge population at risk. This is a major shift in the history of the treatment of relapsing malaria, and it will dramatically change the adherence situation we are currently facing.
It changes policy for the better. It also helps them in their operations. So that's a powerful combination.
We are looking at the realities of implementing new interventions in the field, and that's an important contribution towards actually scaling up new interventions. There are access barriers that we can address to accelerate the uptake of these tools, the use of these tools by national programs.
We can actually take best treatment options safely to those who need them most in very remote settings, and that's something we couldn't do before.
The evidence that we're generating through the PAVE studies is really demonstrating positive results, and we're hoping that these results translate and inspire other countries to introduce and adopt these tools to help support their national malaria elimination goals.